Hello, my name is Andrew Westrick, and today we're going to be looking at exercise and spinal cord injuries. So, to start off with, we're going to talk about what is a spinal cord injury. And a spinal cord injury is defined as damage to any part of the spinal cord or nerves at the end of the spinal canal. Getting into the types of spinal cord injuries, there is complete versus incomplete, and tetraplegia versus paraplegia. So, looking at a complete versus incomplete spinal cord injury, a complete spinal injury describes an injury to the spinal cord in which there is no feeling or ability to control the muscles below the site of the injury, versus an incomplete injury where we're talking about you could be in the same spot, but you do have some motor and sensory function below that affected area. Looking at tetraplegia versus paraplegia, and a tetraplegic is someone who has all four limbs, including their trunk, being affected by that injury, whether it's incomplete or incomplete. And with a complete tetraplegic, they have to be on a ventilator as they don't have any motor or sensory function in their lungs. And a paraplegic is someone who has paralysis in parts of the pelvic organs or trunk and in their legs. Looking at the causes of spinal cord injuries, there are a number of things such as falls, sports injuries, violence, birth, injuries, motor vehicle accidents, and infections of the spinal cord. In the background of this slide, you can see Ryan Shazier, you may or may not be familiar with, an Ohio State alum, who played for the Pittsburgh Steelers and who in 2017 suffered a spinal cord injury on the field and is still working on recovering from that. The signs and symptoms that you may experience if you have a spinal cord injury, no matter how severe or acute it is numbness, difficulty with walking and balance, abnormal weaknesses in the legs or in the upper extremities, and the loss of bladder or bowel control. Looking at the benefits of exercise for spinal cord injuries, it's pretty much similar to a normal, healthy adult that we would think of. Aerobic fitness, muscular strengthening, flexibility, those are all things that are recommended for the normal, healthy individual and are just as important, if not more, in some cases, more important for those with spinal cord injuries. And exercise is the only known intervention for spinal cord injuries that we know works. There is no surgery or like magic pill that you can give to somebody with a spinal cord injury. Exercise really is the most important and only way for us to rehabilitate those people with these kind of injuries. So diving into the types of exercises for people with spinal cord injuries, we have wheelchair propulsion, arm ergometry, free weight resistance training, and circuit resistance training. Wheelchair propulsion and arm ergometry are both important, but they're kind of the old school, if you will, kind of exercises. In recent research, it has been shown that these kind of exercises will lead to more musculoskeletal injury than, say, circuit resistance training. Free weight resistance training is also good, although it can also lead to injury due to a lot of these exercises needing to be with the shoulders or arms. Say if you have somebody in a seated position who has a spinal cord injury doing a military press and they have less stability in their trunk while they're doing it, and something happens where that weight gets dropped on them, it's obviously going to lead to some sort of injury or a scare. With circuit resistance training, it's actually been shown that this is the best kind of training that we can give those with spinal cord injuries. They get the most benefit from them, such as an increase in aerobic capacity as well as in their isoinertial strength. It was in a study shown that isokinetic strength didn't have much of a difference after from pre to post, but isoinertial strength really is what had the significant difference. Next, what we're going to be looking at is the FIT recommendations and application for those with spinal cord injuries. So looking at aerobic, we can see that the frequency for that is less than the normal healthy adult. It's a minimum of 2 days a week, progressing to three. And as it says, athletes can increase from 3 to 5, which is what we see with normal healthy individuals. With resistance training, we see a minimum of 2 days a week, and with flexibility, we see that daily um, flexibility training is what is recommended. Looking at the intensity, time, and type, a lot of it is with the beginners, we have them down as low as 40% to 59% of their heart rate reserve. That's what we're looking for. And with their resistance training, they're using low weight, high reps. That's what the study that showed circuit training was the most effective way to capture an increase in aerobic and muscular strength had. They were using low weights, high repetition, and they were doing one set and then 10 to 15 seconds of rest in between each exercise, and then a larger rest period in between each circuit. And then with the type, what you want to do is you want to engage the largest mass of muscle that you can. So if you have a paraplegic and they have full function of their arms and their trunk, what you want to do is try to engage as most of that muscle mass as you can in that training session. And you also want to make sure that whatever you're prescribing your client, if they have a spinal cord injury, whatever you prescribe them is easily accessible for them. A lot of the exercises are going to have to be a little bit more creative, as they might not be able to transfer themselves from their chair, or they might not have somebody to do it. If they're to be expected to be doing these kind of exercises, between 3 and 5 times a week, then they're not going to have somebody most likely with them at all times, and they need to be able to have access to complete their given exercises. So looking at special considerations for people with spinal cord injuries, a client should empty their bladder or bowels before they start exercising. With paraplegia and tetraplegia, they have a loss of their pelvic organs from anywhere below their injury site, especially if it's a complete spinal cord injury. And if they have, a full bladder or, something in their bowels, exercise can help induce that to come out, which isn't necessarily fun for anybody, especially your client. Another thing to consider is individuals with tetraplegia may have a lower cardiovascular performance. So a lower intensity of exercise may take them to their peak heart rate, where as somebody who's a paraplegia may be able to do a higher intensity, even if they're exactly the same in every single way, except for tetra or paraplegic. Those with spinal cord injuries may fatigue earlier than other healthy adults. When you're thinking about this, consider the fact that when you're on campus and if you are a walker and you're walking between all your different classes, that you're getting a substantial amount of exercise that way, or you can be. And those who have spinal cord injuries and are in a wheelchair and are using their arms, that's an exercise all in and of itself. But that doesn't mean, a lot of that can be muscular endurance just because of the mechanics that you're using between with your legs and with your arms. Their cardiovascular health might just not be to where yours is at. And muscular strengthening exercises should be done outside of the wheelchair. The biggest reason for this is that you want to try to engage their trunk. If they have function in their trunk, you want to try and engage those stabilizing muscles, which is going to help them in their daily tasks, such as reaching or anything like that. And one more thing that I just want to reiterate in the special considerations is that flexibility is considered important enough to be done daily. flexibility, especially if you're in a wheelchair, can be the difference between a good quality of life and a lower quality of life. Being able to reach and have a high degree of mobility through your upper body is an important aspect of being in a wheelchair. Another thing to consider is that with a tetraplegic and complete lesion patient, they're going to have some degree of functionality in all of their limbs and their trunk affected. Working with this kind of patient is you're going to have to be creative in the exercises that you're doing. You're not going to be able to do the same kind of things that you're doing with a paraplegic. They're going to be more fine motor skills, such as you might see with an occupational therapist. And with a paraplegic, it's going to be really important that you work those large muscle groups to give them the most benefit in strength, stabilization, and aerobic capacity. There are no set in stone recommendations when it comes to those with spinal cord injuries. More research in the area of exercise and spinal cord injuries is needed to fully understand what the best possible approach is. As of now, circuit resistance training has definitely been shown to have the highest increase in aerobic and muscular strength from pre to post workout program. So it's really important to keep up to date with what the best kind of intervention and exercise prescription is best for them. Looking at the question that I have prepared, the question is, which type of training has been shown to improve someone's aerobic/muscular fitness with a spinal cord injury the most? We have options of a free weight resistance training, circuit resistance training, arm ergometer, and flexibility exercises. The answer to this question is B, as in previous slides and throughout the presentation, we have discussed that this kind of training provides the largest increase in both aerobic capacity and muscular strength. Thank you for listening, and I hope you enjoy the rest of your week.